So, good day, ma'am. Good day, everyone. My name is Laila Chinkasan from BSN 212A, and today I will be performing a written demonstration in female urine catheterization. So, the purpose of this procedure is for us to collect a sterile urine sample from the patient for laboratory purposes. We are also doing this procedure to help those patients who are having difficulty in voiding, and those patients who are critically ill or those patients who are already bedridden. So before anything else, we must first check the doctor's order to verify the necessity and the type of catheterization that we are about to do, and also to ensure that the procedure that we are going to do is safe and according to the physician's order. So after checking and verifying the order of the physician, we are now going to introduce ourselves to the client, verify the client's identity, and explain the procedure to help the patient know and understand the procedure that we are about to do, ensuring that we provide the correct procedure to the right patient. And this also promotes cooperation. So, good day, ma'am. My name is Laila Chinkason, your student nurse for today. Can I see your wristband po? Can you state your complete name? And how about your birth date? Thank you so much, ma'am. So, before anything else, ma'am, I would like to inform you that the procedure that we are about to do is the urine catheterization. So, this procedure is for us to help you void or help you remove the urine, and also as per your physician's order, we need to collect a sterile urine sample for laboratory examination. So this procedure might be a bit painful po, but rest assured that after the procedure you will feel comfortable and the pain will go away. And also this procedure requires you to expose your genital area. So do you have any concerns po with regards to your procedure that you're about to do? Okay po. So after explaining the procedure, we are now going to perform hand washing to prevent the spread of microorganisms. So after performing hand washing, we are now going to provide the patient's privacy by closing the door of the patient's room to maintain the patient feel comfortable, as well as to and maintain the patient's dignity. So ma'am, I'm just going to close the door po, okay? So after providing privacy to the patient, we are now going to position the patient in a dorsal recumbent with knees flexed. So this would allow us to easily visualize the area that we are about to do the procedure. So ma'am, I need you to lie on your back and your knees flex po, and then feet wide apart, so that I will see or do the procedure effectively and properly po. Okay? So after positioning the patient, you're now going to drape the patient and exposing only the area to be used. So this would ensure that the patient will remain comfortable, as well as to avoid too much exposure for the patient. So ma'am, I'm going to expose your genital area po, okay? And then after exposing the patient's genital area, we are now going to apply a direct light for visualization of the patient's genital area, and for us to easily locate the area to be used. So after applying direct light, we are now going to open the tray with the equipment that needs to be used for this procedure, ensuring that the equipment will remain sterile, preventing it from contamination, and also ensuring that all necessary equipments are readily available. And also placing a waterproof drape under the patient's buttocks to prevent having a mess on the patient's bed, ensuring the comfort of the patient. So now I'm going to first put this pad po on your buttocks. So it also ensuring that we do not touch any part of the central area of the drape. So this is to maintain the sterility. Since our hands is not yet in sterile gloves. So after we ensure that the patient is already comfortable with the position, and then we are now going to identify the equipments to be used. So the equipments that that is needed for this procedure are the following. So we need a lubricant, a specimen container, a catheter, the urobag, as well as the eye sheet, sterile water, syringe, as well as the um, sterile gloves. So after that, we are now going to wear working gloves. So this would allow us to prevent um, contaminating the sterile items. So after putting on the gloves and ensuring that it fits perfectly, you're now going to prepare the syringe for inflating the um, balloon of the catheter. So we are going to use a 10 cc. And then after we prepare the syringe for inflating the balloon, we are also going to um, lubricate the um, catheter 2.5 to 5 centimeters, and also ensuring that we do not plug the drainage eye to also ensure that the urine flows thoroughly and smoothly. So we are going to open the catheter first. So after lubricating, we are also going to place an eye sheet over the area of the genital to avoid exposing too much of the perineal area. So after placing the eye sheet, we are also going to clean the meatus to ensure that before placing the catheter, the area is already clean. So after ensuring that the meatus is already clean, we are now going to pick up the catheter and 3-inch from the tip of our thumb and placing our thumb and our finger into the um, um, for non-dominant hand into the genital area, specifically in the labia minora, and spread the folds gently and to maintain the comfort of the patient, and also to ensure that we see which or to have an easy visualization of the urethral opening. So after picking the catheter, we are going to insert the catheter onto the meatus 2 to 3 inch until a urine flow starts to appear. Okay, ma'am, so I am going to insert now the catheter po. So inhale and exhale. Okay, ma'am, it's painful po, right? So relax lang po kayo. The pain will go away naman po. So after ensuring that we place the catheter properly, we are now going to check. So since the physician requires to give a urine sample, we are going to pinch the catheter in place and then getting the specimen container and place it properly into the specimen collection. So after getting a urine sample, we are now going to hold the catheter in place and then with our non-dominant hand and then inflate the patient's catheter spalding. So to ensure that we inflate the balloon properly, we're going to check if it doesn't slip out of the patient's meatus. So since we inflate the balloon, so now we are going to connect the urine bag or to the catheter, ensuring that making sure that the tube does not fall on the top of the bag. So after connecting the urine bag into the catheter, we are now also going to um, wipe off the excess antiseptic or the lubricant into the patient's genital area to avoid any skin irritation or skin breakdown. So after wiping off the excess, we are now going to secure the catheter with the use of a tape onto the patient's thigh and ensuring that it's not too tight or too loose to ensure that we still allow the patient to move freely. So assuming that the patient's thigh is in this area, so we're going to tape it. Taping it securely to prevent slipping off. So ma'am, isn't it not too tight po ba or too loose? Okay. And then securing the bag onto the patient's um, bed. So after securing the catheter, we are now going to discard all the necessary supplies that we use to maintain the cleanliness of the area and placing the patient comfortably. So ma'am, I am now done with inserting po with the catheter. So I am just going to remove this eye sheet po, okay? And then after ensuring that we discard all the materials properly, we are now going also to ask the patient how they feel after um, the insertion of the catheterization. So ma'am, what do you feel po? And do you still feel pain po ba? Okay po. So after that, we are also going to do the aftercare of the materials that we've used to ensure again to maintain the sterility of or the to maintain the cleanliness of the area. And then after cleaning or doing the aftercare, we are also going to document the necessary procedure that we've do, as well as the size of the catheter and also the um, necessary observations that we have observed. Okay, ma'am, so I'm going to cover your area. So, ma'am, thank you so much po for your cooperation. So, if you have anything um, or any needs or concerns, so just press the button po above your bed and a nurse will attend your concern. Thank you so much, ma'am.